Have you ever had that scare that you might have gotten herpes, an uncomfortable phone call, or some lesions down there that made you overthink and search the internet for answers? Let me tell you something. What if I told you that more than half of American adults, they have herpes, and most of them they don't even know? It's one of the most misunderstood infections out there. There is a ton of fear, there is a lot of stigma, and frankly, a lot of misinformation. Hi everyone, I'm Dr. Peter Aziz. I'm a urogynecologist and pelvic surgeon. Today we're going to cut through all of that. We're going to talk about what herpes actually is, the different types, what to look for, how it's diagnosed, and most importantly, treatment. It's the information everyone should know, so let's get into it. So what is herpes? It's basically a viral infection caused by herpes simplex virus, or HSV. Incredibly common. In fact, according to the CDC, about 1 in 6 people aged 14 to 49 in the United States have genital herpes. But here's the thing. Herpes isn't just one virus. There's actually 2 types, and understanding the difference is important. So there is HSV type 1 and there's HSV type 2. We see HSV type 1 most commonly with oral herpes that are little cold sores that you get or fever blisters about your mouth and lips. It's extremely common, like about 90% of the population, they have that. Even though you can still get HSV2 around your mouth and lips, however, HSV1 is the most common in this area. So here's where it gets a little bit more complicated. While type 1 typically affects the mouth, it can also cause genital herpes through oral genital contact. So if someone with an active cold sore performs oral sex, they can transmit HSV1 on their partner in the genital area. The second type is HSV2, almost always transmitted sexually. Primary cause is genital herpes. Spread through skin-to-skin contact through vaginal, anal, or oral sex with someone who has the virus. The key takeaway here is both HSV1 and HSV2 can cause genital herpes. So how is it transmitted? It's pretty much direct contact with the virus. It can happen through kissing someone, sexual contact, vaginal, anal, oral with someone who has the virus as well. Skin-to-skin contact with an infected area. Now, this is very important. You can transmit the virus even if you don't have any visible sores or lesion, because there is something called asymptomatic viral shedding, meaning you have 0 symptoms whatsoever, but you are still having active viral shedding or replication around the skin area. This is one of the reasons herpes is so common, because people don't always know they have it, and they can unknowingly passing it to others. So when symptoms do occur, this is what they actually look like. So the initial outbreak, the first outbreak is usually the most severe. Typically happens within 2 to 12 days after exposure. You might experience small, painful blisters or sores in the genital area. It can be on the buttocks, it can be on the thighs, it can be around the mouth, depending on where the infection is located. Before the blisters appear, you might feel tingling, itching, or burning in the area where the sores will develop. The blisters eventually break open and they form painful ulcers. Then these ulcers then crust over and heal, usually within a couple of weeks. During a first outbreak, you might also have some flu-like symptoms, some body aches, some swollen lymph nodes, headache. For women, the sores can appear around the vulva, the vagina, around the anus, sometimes even the cervix. Urinating can be painful as well if the sores are near the urethra. So what about recurrent outbreaks? After the initial infection, the virus stays in your body permanently. I know this is not what you want to hear, but it actually lays dormant in the nerve cells, and they can reactivate periodically, causing outbreaks. It's not something that we can cure, unfortunately. So the recurrent outbreaks are typically less severe and shorter, usually last maybe 3 to 7 days. Before an outbreak, many people experience what is called a prodrome. That's like warning signs that something's going to happen, like tingling, itching, discomfort in the area where the outbreak will occur. The frequency varies from one person to the other. Some people, they have frequent outbreaks, especially in the first year. Others rarely have outbreaks. Over time, the outbreaks typically become less frequent and less severe. There are certain things that can trigger the virus, like stress, illness, fatigue, menstruation, having a weakened immune system, like if you have cancer, getting chemotherapy, HIV. So how is it diagnosed? If you think you have herpes, important to see a healthcare provider during an active outbreak. This is the time that you would have the most accurate diagnosis. The doctor can take a swab from the sore and send it to the lab. The testing can confirm whether it's herpes or no, and can tell you if it's herpes type 1 or type 2. Blood tests can be used, however, they're not generally recommended if you haven't had symptoms. These tests, they detect the antibodies. It can tell you if you've been infected with type 1, type 2, or both. However, they have limitations. Number one, it takes time to produce antibodies. It can take up to months to develop antibodies after an infection. Also, a positive blood test tells you that you've been exposed to the virus at some point, but it doesn't tell you when, where on your body, or if you'll have outbreaks. Like I explained to you before, there's no cure for herpes. Once you have it, it stays on your body forever. But the good news is herpes is very manageable with treatment. The treatment would be antiviral medications. This is the primary treatment options. Most commonly prescribed ones are acyclovir or valcyclovir. These medications, they work by stopping the virus from multiplying. They can help in several ways. Number one, they can shorten the duration of outbreaks, and they can reduce the severity of symptoms. They speed up the healing, and they also reduce the frequency of recurrent outbreaks. Most importantly, they decrease the risk of transmitting the virus to sexual partners. So there are a couple of options. There is something called episodic treatment, meaning you take the medication only during outbreaks. You start taking the medicine at the first sign of an outbreak, ideally during the prodrome phase when you start feeling that itching or tingling. This can help reduce the severity and duration of an outbreak. The other option is something called suppressive therapy. Suppressive therapy means taking antiviral medication every day, even when you don't have symptoms. This approach is recommended for people who have frequent outbreaks, typically more than 6 per year, or for people who want to reduce the risk of transmitting the virus to a partner. The suppressive therapy can reduce the frequency by up to 80%, and it also significantly reduces asymptomatic viral shedding. I know that herpes diagnosis can feel overwhelming to a lot of people, primarily because there is a lot of stigma around it and that it can be difficult emotionally. But I want you to know that it's actually a very manageable condition, and millions of people live with it a healthy life. It doesn't affect your general health in any way. It's not dangerous whatsoever. Yes, it is annoying, and it's also annoying to disclose the status to sexual partners. But it is important. Honest communication is crucial, both ethically and to protect your partner as well. I've seen that many people, they fear rejection. But remember, when you explain what it is, how it's managed, how it's being transmitted, a lot of people are actually understanding. So if you do have herpes, there are ways that you can do to reduce the risk of transmitting it to a partner. Number one, use condoms. While doing condoms don't provide complete protection, but they can still have some protection, and they significantly reduce the risk. Avoid sexual contact during outbreaks, including the prodrome phase. Consider suppressive antiviral therapy if you're in a relationship with someone who doesn't have herpes. Talk to your partner about getting tested, because if they already have the same type of herpes, then transmission is not a concern. Just remember, it is not dangerous. If you think you might have it or you have questions, talk to your healthcare provider. They can help you understand your options and create a management plan that works for you. If you find this helpful, please give it a thumbs up, subscribe to the channel. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.